this is great because this is absolutely unique opportunity for us to start clinical trials in Princess Margaret Cancer Center. Opportunity to make another step in detector development and ultimately to have impact on healthcare.
So the clinical trials haven't started yet?
No, clinical started, already started. We already have clinical data, very encouraging and very impressive results. We were able to see early cancers. We were able to see inflammation in the breast, which is very important to find the correct treatment and also like a prognosis for cancer development. So I can't get into lots of details about clinical data because it is under evaluation right now. But first results are very encouraging, and we have a plan to make 40 patients during 1 year, first year of the Canadian Cancer Society. It's Canadian Cancer Society grant.
How important is this funding to continuing your work and continuing it over the next 3 years?
It is extremely important because there are not that many grant agencies which allow to use money for clinical trials. So I was successful in grant applications which allowed me to develop our technology for the molecular breast imaging. But the Canadian Cancer Society today is the only grant agency which finance clinical trials, and we can't accomplish our goals without clinical trials. For sure, we need commercialization, and we also need to bring our technology to clinics through marketing of our device, right? And we're also working on next generation of the molecular breast imaging device with an idea to reduce the cost, because it's also very important. Our healthcare today is very expensive, and cost reduction is an important goal in our research. But to answer your question, Canadian Breast Cancer Society grant is, I would say, unique today because we can do both. We can finance clinical trials, we can scan 40 patients, which is of paramount importance for us to evaluate the efficacy of our device, and we also can start working on a new generation of our molecular breast imaging technology with the goal to reduce the cost.
Can you talk about how this program, the device that you are working on, is better than past mammography systems?
I can't say that it is better. Today we are in the era of personalized medicine. Personalized or precision medicine means right treatment to right patient at the right time. But the personalized medicine cannot be accomplished without personalized diagnosis. X-ray mammography is general purpose device. It is not equally efficient in different cohort of patients. So what we are doing is aligned with the idea of personalized medicine. For those patients for whom mammography is inefficient or results in suspicious but inconclusive findings, molecular breast imaging is an alternative or adjunct technology which can find early cancers and also can help to find the best and most efficient treatment.
And I was just curious about the clinical trials. How long do you see that going on, and then what happens after the clinical trials?
After the clinical, we are planning to scan 40 patients. So this will allow us not only to evaluate our technology in clinics, but also it will be very important feedback for further development, for further improvement in our technology, and for sure next step will be commercialization. Because if we want to make an impact, we need wide dissemination of our results, right? We need to bring our technology to more clinics, and we need to work on adaptation, clinical adaptation of our technology. So next is commercialization.
How can this program also help women with more dense breasts?
This is very good question, because exactly our technology addresses this important but unfortunately unmet need to find early cancers in dense breast. Our technology is inherently, or performance of our technology is inherently independent on breast density. So we can find even non-invasive cancers in dense breast. This is very important for women at higher than average risk of breast cancer. For example, with the history of breast cancer in families, for those patients, breast cancer detection is prescribed at much younger ages, when breast is very dense, and that is why mammography is inefficient for those patients. Not only mammography is difficult for patients with dense breast, breast density is also a risk factor. So women who have dense breast, they are more likely to develop breast cancer. So that is why we need to find a solution for those women who have dense breast and for whom, unfortunately, mammography is inefficient. I am talking about conventional X-ray mammography. So our molecular breast imaging is inherently independent on breast density, and that is why we believe that it will be paradigm shift in breast cancer detection. So it can replace mammography as a screening tool for women with dense breast.